Good afternoon and welcome to United TV. My name is Kamal Arkan. Today is December 20th, 2024. This is our last episode right before Christmas. We were going to have a guest speaker who is now actually scheduled for January 17, Dr. David Feinberg, CEO of Oracle Health. He will be with us. He's confirmed. It's just with the holiday schedules, things can be a little bit more challenging, but we'll be having him on January 17th. Um, Today, actually, I want to start with some good news first. We have a lot to cover. So Turkish Airlines, hopefully President Erdogan is watching this, so then we can get some free upgrades because I couldn't get my last upgrade yet, but I'm sure they will work on it. So they are the Guinness World Record for most flights to most countries. So I didn't know that. You guys may already know that. That's the choice for me. But this is not their first one. Other than the most countries, they also have the longest distance flown in a hot air balloon. Most countries served by an airline, largest Turkish coffee tasting event, and the longest in-flight concert. So these records are also owned um, by Turkish Airlines. So and now hopefully they can have their system work and I get my upgrade done. But other than these recognitions, I know that they have been actually really doing a great job. And what we would like Turkish Airlines model to be done for the other industries, such as healthcare, especially in Turkey, they can actually copy what they do in terms of customer service and take that to a patient service, which we are going to actually talk about that in the future episodes because it's a larger issue than what we have. But for now, we congratulate Turkish Airlines and I will be with them at the end of January. So now we have a lot of not so great topics to discuss, and we'll start those one by one. Um, so, and also in advance, I want to apologize for coughing crisis that may be coming to your way. So will be I may actually have some of those coming up. Um, we'll cut them out after the live is done. So school shootings is again this is something that just happened again in Wisconsin. This time, the person who initiated this is a 50-year-old female. Apparently, that's pretty rare. So less than 1% of the total number of people are females. But still, this is happening. Now, two students died, and then 6 of them were injured. So in this year so far, there are 83 total school shootings in the United States, with 27 of them being in the college campuses and then 56 of them being K-12. And in those, 38 people died, and then 115 people were students, and most of them probably were students injured. So why do we have this issue in United States? And this is again not being done in other. We don't see this in other countries the way we have it here. So the issues that we discussed with our political guests last year, as we were asking them what are certain measures that they would take for better gun controls. And then we did hear back from so many of them, and there were some updates were done in terms of background check, waiting period, but the issue in the United States is getting a gun is so easy. It is way too easy, and it shouldn't be. Not everyone should have one, and there should be a process in place. Now, like in Turkey, for example, getting a gun is a big deal. The governor needs to sign off on that, and most European countries, it's probably similar at the level of how strict this is. So we know that this is not the way that we should be dealing with this. Now, one of the issues that we know, the mental health services and not having this available for everyone, and it's not being accessible. But again, I think this starts in the family, then it goes to the schools and it goes to the public. So we really need to actually have a better control on these and better services. And also improving school safety measures is another issue that I see as a weakness. Like I actually visited my college in Turkey when I was there last month, and we had to go through a security check before we got into the campus. So now, if you are at UD or Golden Beacon or Wilmington University, anyone can go anywhere with no screening. So without any screening. So that actually, like, if you think about it, we go through the security at the airport, and then how much dignity is being kind of like every time I go through that, I feel like this shouldn't happen to me or this shouldn't happen to anyone. So we take this way too seriously at the airport, but then anyone and everyone can go into any of the school campuses with no issues. So I think maybe there are certain measures that can be taken more seriously. And of course, it always comes down to the media, and media is a huge problem, as it may not be actually, as we may not be kind of monitoring it or controlling it in a way. And I'm not suggesting any of control on freedom of speech, but when it comes to violence, there has to be certain measures that we need to take. So if the media is promoting guns and promoting violence, and this should be, and in some of the games that kids are now playing, they think that the world is just, one of those video games. So being totally out of touch with the real life, they may not understand what this does when they actually when they harm someone. They may not understand the actual sense of what they have done. And then this is one of those issues that we need to really look into it very closely. Now, this actually brings me back to one of our other issues that we have. So I know Ethan is helping me here with the pictures, and I am going to share one of the pictures with him. And this is all these issues, including the school trouble that we have, school shootings that we have. We have another issue right now, and that is Luigi Mangiani. And so between Ethan's picture and my picture, I'm kind of like, so now your video is playing and then I have my picture. So this is unnecessarily taking a lot of time from public. Why? Is maybe because the person who died is a high profile name. The person who killed is a high profile name. Now, I talked about this last week, and when I was covering this, it's one of those things like, you kind of try to have empathy with either party, like what may be happening. Now, I think media is not covering this right again, because when we look at what's happening, by the way, my picture didn't come up. I just did it again. If it doesn't come up, fine. But earlier, you were able to see Turkish Airlines, right?
Yeah, all three.
So, okay. Well, again, the issue with this is that we have a 26-year-old who actually comes from a very wealthy family. And then why I'm saying that media is not covering this right is because they're not actually guiding the public properly. What I mean by that is um, there's something that just doesn't make sense. It just doesn't make sense. So let's say if I want to get the email of one of the CEOs of one of the healthcare companies, unless I know exactly how their name is spelled and how their name, the official name is, because sometimes they may have like middle initials and other things, and the format may be different. I may not even get, even me, I may not be able to even get that person's email. So the access is pretty problematic. So, like, if you were to ask me how to get United Healthcare CEO's email, I really don't have any way of knowing what his email is. My point is, if it's so difficult to get this person's email for someone like me, how is someone like Luigi is able to get his full program, knows where he lives, knows where he stays, knows where he goes? So the point that I was trying to make last week was, well, there has to be some other types of relationship between these two. So they, in my opinion, they probably know each other. So if that's not the case, then perhaps perhaps I'm wrong. But there is a huge uh, part that's missing. So now, as you kind of look into this a little bit more, what you also see is Brian Thompson. Actually, yes, he's married with two kids, but they don't live together. They have separate lives. So now, 26-year-old, his sexuality is kind of being questioned by public, and Brian not being with his wife. So the issue comes down to probably some private relationship that they have that things maybe didn't go through right. Because, as I mentioned before, this is not someone who is a person who's struggling um, with health insurance or with day-to-day expenses or with any of those types of issues. This is a person who comes from a wealth, who has great education, who has everything that he can ask for, and yet he's gonna give that up and just kind of go out of his way to get in trouble. And he's not going to have good time in prison. He's a good-looking guy, so probably he's going to be someone's bitches for the rest of his life. With the surgery that he had, things are going to be even more difficult and more painful for him. So I just want people to kind of understand that this is not just some hero who just went after the you know evil healthcare insurance executive. This is not the case. Now, if you think about it, if this comes from his pain and other things, his surgeons would be in question, right? Or his hospital maybe didn't handle things properly. But again, that wouldn't explain and that wouldn't excuse any of the things that he did. This is one of the issues that I have a huge problem with. When people say, yeah, he did this, but there's no but. There's no however. There's nothing there. This is a pure evil act of terror from this guy. And someone's life with two kids, find the wife doesn't live with him, but the kids, he's the father of those kids. So he bought a house in the same neighborhood. So that means he wanted to be closer to his kids. I talked to some United Healthcare employees because we have meetings with that insurance, and they have nothing but say good things about him too. So there's something again missing, and I think it's going to come out. The other thing is that yesterday, when he was transferred to New York, the way that they are kind of handling this, and I really don't understand. I wish that I could talk to some of the police officers. I invited Kathy Jennings, our Attorney General in Delaware, and she did say that because it's an ongoing case, she cannot make any public comments. But my issue is, why do they try to give a lot of good pictures with him? Like, it's just like, as someone who wants to be the center of attention for just 5 minutes fame, it's almost promoting that type of action. That's what I'm seeing, and then that I have a huge problem with that. So that shouldn't be the case. So, like, he's almost being treated like a hero, like in those movies that you see, and that can actually have a lot of impact on the young individuals who may not really have a good understanding of life. And I think media is still responsible for, and also, honestly, even the police department is responsible, um, to make this so kind of glorious. Why do we have to see this much of this? Why don't we see much of the school shooting, but we talk about Luigi all day long? Why do I even have to talk about this now? Is because everyone is talking about it. And also making the healthcare individuals target. So that's a huge problem. All right. So far no coughing, so I'm doing okay. So we can go to our next topic. So there was an article regarding the U.S. healthcare costs. Now this is again with Luigi's case. Things are being connected in a way that, um, is there a real issue in healthcare? Well, there is definitely an issue in healthcare, but this is not with one isolated group of companies or group of hospitals. It's an overall system issue. Now, what is this issue? This includes us as patients. So I actually was watching some of the videos who are supporting Luigi for what he has done to a healthcare guy. And people who were complaining about the system also were the people who were probably abusing the system. Now, remember, in the United States, if your primary care physician wants you to get an MRI for some issue that you may have, regardless of it's definitely necessary or not, you can still get it. Now, when sometimes it's not being given to the patient, we have a lot of unhappy patients that are saying that I want to have an MRI. And when do they want it? Tomorrow. When do they want it? Today. So they don't want to even wait. So now in Canada, that MRI won't happen for at least 9 months. In England, it may take 12 to 15 months before it can happen. In most of the other European countries, again, it's similar to 12 to 15 months. What I'm trying to say here is we all are responsible for what the system is. So you cannot take yourself out of the system and blame everyone else, saying that, well, we are way too expensive. Well, we're expensive because of us, people, like people who are demanding. So, yeah, am I saying that I agree with certain, cost and like the expenses, the way that it's set? We covered on this channel so many times. No, we are not. In fact, we were the one who supported HB 350 bill in Delaware, where it actually monitors hospital spendings, hospital costs, and not having no real price cap. Yes, but then when you have a demanding market, then there's not much you can do. Now, one of the things that was said here is the fee for service. This is one of the articles that actually had a lot of hits. And fee for service it has of course some disadvantages, but I think it's necessary because when you go to the capitation system, then the quality is going to be actually kind of jeopardized. So the best way of looking at it is, instead of saying fee for service is the problem, it is actually the model where it can be a hybrid model between fee for service and the value based contracts, which United Medical ACO has 9 of them right now, with almost close to 85,000 lives in the state of Delaware. Now, one of the things that this article is making, one of the points is high specialist salaries over primary care. That's from the salary standpoint, that's correct, but those are the individuals who have more education and more expertise. So, like the cardiologists, just for a non-invasive cardiologist, they have 3 years more on top of their three years residency. So, and then if they are also going for the interventional cardiology, they have to do another year. So they will have more than the initial base residency in any case. So I think instead of looking into that from that point, looking at it as how these individuals are being employed, because what we have also discussed in this channel for so many times, the issue becomes when the hospitals under the nonprofit label, they can actually offer more for certain specialties and certain physicians as well. And I made this point very clear when we reviewed the Christiana Hospital's tax returns. You can see some individuals who are physicians there, and their salaries are way off the averages. So, and this is a problem that I see, but not as like the salary, but more about who's employing the physicians. That actually is the bigger problem. So administrative overhead, absolutely, that's a big problem in total cost and hidden prices. This usually comes to the hospital work. So because we don't really have a good understanding of the bill that we are getting from the hospital, if you go to your primary care physician, you'll see one CPT code. But when you go to the hospital, things are under the revenue code, and it's not the same. So even I wouldn't understand what they are billing for. And yes, there are a lot of hidden costs. Now, sky-high prescription drug costs. This is important. And just last week, as I actually went through this cold or whatever I'm having these days, one of the things I insist, like it goes back to the customer, the patient who's part of the system demanding something from the system. I had a cold sore and then I want to have Ultrex, but I wanted not the generic, I want to have the brand name. For 14 pills, I paid $400. So my insurance didn't cover, which I was fine with because I want to come back to today's show with no cold sore. And it does work, but it's $400. When it's generic, it's after my insurance pays, my portion was $2. But I wasn't happy with that. I wanted to have that brand. So that means there's a problem. There's a gap between the generic and the brand. So then when this is if this is part of the system, this needs to be fixed. I mean, for 14 pills, I mean, since Ethan is in the room and he's making faces, this is real. I'm not exaggerating. So it's $384 to be exact. So for 14 pills. And it doesn't cure cancer or Alzheimer or whatever some big complex issue is for a cold sore. So, and again, who's the problem? The patient. The patient is me in this case. Who's the problem? It's the system, because the system makes money from this. But this is the way that we are able to fight with these issues is not going out of our way and kill people. That is terrorism. The way we have policies, procedures in place. We have what we are doing right now with this channel. I could easily cancel today's episode saying that I have cough and I don't want to have that in front of everyone. But this is our voice. So when we hit 100,000 subscribers, that voice is going to become bigger, right? So there are ways to actually voice your opinion without killing people. So all these issues should be discussed, and we are actually addressing some of those from our level. But the reality is the prescription is a huge problem. Now, one last issue that is becoming more common is the private equity influence. So big investors, these companies, they buy these um, specialists usually, and then they are offering them a lot of money. And one of the ways that they can actually get that money out is almost generating a monopoly in the small market, and then with a certain specialty, and then try to kind of uh, twist the insurance companies arm for higher uh, reimbursements. This actually is happening right now in Delaware. So, without mentioning the names, two cardiology groups were bought by the same private equity company. So, I know one of the groups, and I know the other group a little bit less than the other one. But right now, when those two merges, there isn't much in cardiology, in especially in Newcastle County, other than the hospital system. So, because it never made sense why they would be paying so much money to the practice, knowing there isn't any actual equity in those and assets in those. But then, if they're able to use the system and then get higher reimbursements, so the private equity firms can become a huge problem for the overall cost. And also, where do they get this money should be looked into. Like, why do they feel like they can actually put that much money into the practice that's not making that much? Is it a way of money laundering? Is it a way of getting the money into the system, and by doing that you can use the healthcare system and healthcare practice? Possible. I don't know for sure, but it is possible. But this is happening, and this will have this impact of these will be felt probably in the next couple of years. It may not be immediate, but this is something that Attorney General's office should be looking into very closely. So, and this is true also for the hospital systems when they actually merge. Like in Newcastle County, we have Christiana Hospital, and we have very little St. Francis. When that means there is really no competition, none. So whatever Christiana wants, whatever Christiana gets. So when you don't have a market that's open for competition, then we end up paying more for all these. But again, everything can be controlled under the monopoly policies, and it's just like we need to look into these instead of saying that hey, this is the nonprofit hospital, so great. Well, 2.2 billion and then 1 billion profit in the last 5 fiscal years is real number. So we kind of need to wake up and then understand what I'm saying here. So these are not nonprofit organizations. These are very profitable organizations, and then they are done um, under the uh, existing law that allows them to do whatever they want to do, and then the media covers them really nicely. So the United Medical is the evil for-profit organization. Christiana is the or Bay Health or BB. It's just not. It's not about one hospital. So they are the nonprofit. They are not nonprofit. Look at Bay Health's entire profit for the last 5 years, close to 400 million in a small hospital in Delaware, the second smallest state in the United States, in the smallest county. Hospital makes tons of profit. Those should be looked into with this private equity issue as well. So that is our another ugly topic that we had to unfortunately talk about today. But the one issue that becomes a problem for us is the latest issue with the recent spending bill with the Congress right now. So every time we see these issues, what actually they're about to pass or they are not able to pass is a interim solution that that actually helps for the budget, the fiscal budget, to go through end of the year so that people can get paid, blah, blah. Like this is the same shit every year. unfortunately, Congress is, and the Senate and Congress together, they are actually doing this. Now, one of the funny messages that I received from one of my people today is like, hey, they just leave these things for last minute, but there will be a resolution. He's probably right. Now, here's the thing though. Why do we need the CR for the current situation? Is because the one that supposed to pass, it didn't go through. And why it didn't go through is because, well, Republicans, in some cases, rightfully had some concerns. The spending cuts is a huge problem where you kind of keep spending high. That's inflation, and then that's everything else that we do today. So defense spending and the border security, Ukraine by itself, those are, again, it's a huge problem for most Republicans. And it's interesting to see 30 of them, or 31 maybe, they opposed to the resolution, so even in their own party. Now, this will go through. I don't think this will shut down the government. So that's one thing that I know. But one of the things that I want to share with you guys, so
It came up.
yeah, that does come up. So it's just like with this, since we are using the iPad, there's some difficulties these days. So the part that I did here is I compare the 2016 to 2025. Now you're going to say, well, it's 9 years. Doesn't matter. Well, it does matter. Now, in this 9 years, our GDP went from almost 19 trillion to 29 trillion. But when you look at these in percentages, that's about 56%. Now, total spending in the same comparison from 16 to 25 is 77%. What we pay on that interest is about 300% more. So then mandatory spending, that's about 79% more. So if you see the government as just like a family with two kids, let's say wife and husband works together, and then let's say they make 250,000 a year, but they want to spend 350,000 every year. So that means they have to borrow 100,000 every year. So then they have to pay interest on that 100,000, and then they have to make minimum payments, and interest is going to go up and up and up. At some point, it's going to collapse. So the governments are working very similar to that, where if our GDP went up by 56%, and if you are spending averaging 75% more, then this is not going to be sustainable. At some point, it's going to collapse. So that's why you see some of the Republican views, and this is where I feel I'm kind of closer from fiscal budget responsibility standpoint to the Republicans, is because you have to really live under below your means, meaning that if you make 250,000 in that example with that family, you should not be spending more than 200,000 a year. So then you should be saving, which you can do that. But if you always want to borrow and pay interest and do this, do that, at some point, that's not going to be sustainable. So that's part of the issue here with the budget. Now, again, this whole anxiety that they're creating is, I think, I have a lot of politician friends, so I don't want to offend them, but I think they also kind of make themselves more important by giving us this last minute anxiety, because this also can impact some of the healthcare fundings. If there's any disconnect and there's a shutdown, this can actually create a lot of trouble, and hopefully it won't get to that point. This was more like a summary of this issue. There are more we can discuss, but a lot of them are already available. But I just want to make sure that people understand that this is happening because we spend way too much, and that needs to stop at some point. So, and hopefully they can find the right balance, and then the resolution should be coming. I think they're going to end up working this weekend, and then they're going to make us feel sorry for them all. Or you work over the weekend, so sad. But the reality is they should have done it earlier, and things should be okay at the end of the day. So those are what I have today. Today we have our Bariatric Friday with Dr. Ergao. He should be here soon. We'll start at 3 p.m. We'll be covering intermittent fasting, which he and I, we pretty much do most of our times. And we covered that issue in the past, but we want to make sure that we can bring different perspective to the intermittent fasting and the utilization of that in the bariatric surgery process. So that's all I have for today. Next week, before we see you again, is Christmas. So it's okay to say Merry Christmas. So Merry Christmas. And if you are Muslim, I'm not going to say Happy Holidays because there are no holidays for Muslims next week. So the only holiday we have right now is the Christmas. So Merry Christmas, everyone. So we'll see you next week. Bye-bye.